Gary Crowley here with step 1 of knee pain relief. What we're going to do in step 1 is we're basically going to release the muscles that attach to the front of your knee and on the sides of your knee from up above, and we're going to release the muscles in the back of your knee. But step 1, what we're going to do here is we're going to have you notice where your knee pain is. If it's down the outside, you're going to come up basically up about 6 to 8 inches on the outside of your knee, and we're going to feel for all the tender tissue here. If it's down the front, we're going to come up 6 to 8 inches and feel all in here and notice where the tender tissue is. If it's on the inside, we're going to have you come up here and notice where all the tender tissue is. Once you identify where your pain is and you've figured out where some of the tender tissue is, I'm going to have you do the hand-on-hand technique where you're going to press on that tender tissue, and you can do one of two things. You can press on that tender tissue and do the press, pull, release, press, pull, release, press, pull, release technique. Then you move to another spot, press, pull, release, releasing them as you go. Or you can, I find it easier if you stick something under your leg a little bit if you're going to do the press, hold, move technique. But same hand on hand, find your tender spot, press, hold, move, press, hold, move, press, hold, move, and just go around releasing all that tender tissue, which means it's too tight tissue. And as it releases, a lot of times your knee pain will just disappear. If your knees pain's on this outside, you're basically going to scoot around the side a little bit, either press, pull, release, or press, hold, move on each spot. Same here. You got your sartorius muscle here. A lot of times this gets tight. That muscle goes all the way to here. It's the longest muscle in your body. But a lot of times if you get pain here, that sartorius muscle is kind of annoyed at you, and you do some press, hold, move, press, pull, release, press, pull, release. Actually, I like the press, pull, release a little bit better on the sartorius. Just seems to respond to that. So that is step 1A. The next step we're going to do is release the back of your knee. And there's basically two muscles back here that if they get tight, they kind of torque your knee joint, and sometimes your knee will hurt. Now you do want to be careful going back here, but basically what you want to do is you want to get either your two thumbs or your fingertips, basically a kind of hand-on-hand technique back here, and you want to feel where it's tender. And then you can either do the press, pull, release. You can actually support your foot if you want. If you're going to do press, pull, release, maybe support your foot. If you're going to do press, hold, move, then you're just going to press and hold and make that knee function. And actually a little bit of both is probably good, but you do want to be gentle back here. You don't want to jab around too much, but when you find a tender spot, just press on it at the level you can relax into. Do press, pull, release, press, pull, release, press, pull, release, or do press, hold, move, press, hold, move, press, hold, move. And so that is the front of your knee and the back of your knee release. A lot of times, any pain around here, sometimes you can just fix it in literally 2 minutes by doing that simple technique. That is it for now. I will see you at the next technique. Thank you very much.